Hello everyone. So as we saw in the video, today we're going to talk about Tourette syndrome. Tourette syndrome is a neurodevelopmental illness characterized by involuntary repetitive movements of hands, eyes and your body. So Tourette syndrome, named after the French neuropsychologist Georges de la Tourette, was coined in 1800s. Georges de la Tourette also said that this is a complicated and diverse syndrome which may affect both children and adults. Now let's move to why Tourette syndrome piqued the researchers' interest. Majorly, Tourette syndrome piqued researchers' interest because of its impact on individuals' daily life. Tics, as we saw in this video, vary in kind, severity, frequency. It can be as simple as motor tics with just eye movements, head jerking or hand movements, to more severe ones including full words or sentences. Now there is also a kind of tic called as coprolalia, which basically is the emission of socially unacceptable or obscene words. As we saw in this video as well, she used a few bad words. Now this is uncontrollable, involuntary of course, and at the same time this is also a very rare but most well-known symptom of the Tourette syndrome. Now Tourette syndrome is said to have a very strong genetic foundations. It is said to be passed down through hereditary in the family. It is also hypothesized that Tourette syndrome is also having roots with some neurotransmitter abnormalities, mainly dopamine and serotonin abnormalities are said to be the cause of Tourette syndrome. With development in research and neuroimaging techniques, it was also found that structural and functional dysfunction or structural and functional abnormalities in few brain structures such as basal ganglia or cortex can also lead to tic syndrome or Tourette syndrome as we call it. So this was a brief introduction to the roots of what Tourette syndrome exactly is. Now we will move on to its impact on daily life. The severity of Tourette syndrome can differ from person to person, and similarly the impact on its daily life also differs. A few social and interpersonal effects of Tourette syndrome could begin with mockery or bullying with people suffering from Tourette syndrome. Children and adolescents who are diagnosed at an early age can go through severe bullying, teasing, catcalling and social exclusions by their peers. Now, if these feelings, these emotions linger into adulthood, it can impair a person's ability to make new acquaintances and have any kind of social interaction with new people. People with Tourette syndrome have seemed to become more self-conscious, which leads to social anxiety and in general limiting their ability to make new interactions. As we mentioned earlier, another common symptom of Tourette syndrome is coprolalia, which is emission of socially unacceptable or offensive words. Now, tics that involve coprolalia can have a negative impact on social relations as it can cause a lot of misunderstanding, putting severe strain on relationships. People who do not understand the causes and the effects of Tourette syndrome on an individual can consider these vocal tics to be deliberate attempt to seek attention, or they can just be considered offensive, which can put a lot of strain on an individual's relationships. Moving on to a few occupational impairments, the major occupational difficulty found with people suffering is the difficulty in concentrating and completing a task. As far as rapid and uncontrollable motor tics is involved, it majorly interferes with precise activities like data entry or checking everyday tally lists. These are precise activities. So motor tics are seen to be involved in that. Similarly, vocal tics are seen to be creating a lot of disturbances in activities concerned with meetings or presentations. Now, it is also seen that tics are exacerbated by stress, causing a vicious cycle of stress, prominent growth in tics, back stress and prominent growth in tics. Meaning that when there is an increase in stress, it is seen that the frequency, range, and severity of tics is seen to grow. And this vicious cycle continues. Now, jobs requiring public speaking, such as teaching or customer service, may become increasingly difficult for few people suffering from Tourette syndrome due to previously mentioned social anxiety, or just in general the interference of vocal tics in daily activities. Although it is also found that many people with Tourette syndrome achieve success in such activities if they get themselves involved in variety of jobs and in working circumstances that are accommodating and supportive, with having people who understand your disorder and with people who are supportive. Many people have achieved success in such public speaking jobs as well. Now, some Tourette syndrome patients also choose to take medications. While these medications are seen to increasingly help reduce the frequency of tics, they also have certain side effects like drowsiness, weight gain, which can impair work, performance, and overall functioning, as an individual does not feel at their best after taking these medications, which can drastically deter their quality of work. Now, moving on to a few treatment strategies for Tourette syndrome. First, we have antipsychotic treatments. Antipsychotic is considered as a tier 2 level treatment for Tourette syndrome. Firstly, there are typical antipsychotics like haloperidol and pimoside. These are the only two US FDA approved medications for Tourette syndrome. According to a research conducted by Buteman in 2014, it was found that these two medications are seen to achieve 60 to 80% reduction in frequency and severity in most Tourette syndrome patients. Now, we also have a few atypical drugs such as risperidone and aripiprazole, which have been investigated for their potential benefits in improvement of the Tourette syndrome and other comorbidities as well. However, there is a lack of evidence, or there needs more evidence or research to prove the competency of atypical antipsychotic drugs. Next, we have habit reversal therapy. This is the first psychotherapeutic strategy that has showed promising results in lowering the tic intensity. Awareness training in habit reversal therapy has 4 components. Firstly, stage 1, response description. As we see in this picture, a patient learns to describe their tic movements and enact them in front of the mirror in order to make easy identification. Then stage 2, response detection, where a therapist aids the patient in detecting the tic movements immediately after they are occurring. Then stage 3 is known as the early warning procedure. In this, a patient learns as to how to identify the earliest signs of tic occurrence. They learn to identify the immediate beginning of the occurrence of tics. And stage 4, situational awareness. In this stage, patients with Tourette syndrome are helped, and an analysis is conducted to identify high-risk situations or high-stress situations in which tics are most likely previously occurred or most likely usually occur for that particular patient. Lastly, a few long-term management techniques for Tourette's include psychoeducation of individual, families, and educators to develop strategies for maintaining tics in schools and other settings. It is also important for people suffering with Tourette syndromes to join emotional support groups or connecting with people in order to get emotional support and develop practical coping strategies. It is also recommended for them to regularly meet with their healthcare providers, manage their medications, and adjust their treatment plan accordingly. Lastly, everyone suffering with Tourette syndrome is advised to maintain a healthy lifestyle, including regular sleep, regular exercise, and all of this can assist patients in better managing their disease and dealing with the physical as well as the mental components of the Tourette syndrome. Thank you.